Welcome back. Let's take you through the latest coming in on the GBS outbreak, the recent outbreak of the GBS in Pune, where more than 100 people have been confirmed death, and we are just getting in news of one reported death as well. People are, of course, worried, but medical experts are emphasizing that GBS is a treatable condition, urging public to stay informed and not panic. So we thought we should sort of dive deep into understanding it a little bit. So what exactly is GBS? Now, GBS is a rare neurological disorder where the body's immune system mistakenly attacks the nerves. This can cause weakness in the limbs, in the neck, face, eyes, tingling or numbness, or difficulty in walking, swallowing, or even breathing in severe cases.
Now, the illness can appear suddenly and it usually progresses over a period of 4 weeks. But sometimes you even have instances take place where the case worsens very, very rapidly. It doesn't take that 4-week period, much more rapidly, and then you require intensive care. Now, we thought, as we're seeing it play out in Pune right now, this big question, is it an outbreak or not? We wanted to get clarity on that. Health authorities are suspecting a possible link to a bacterium that can spread through contaminated food or water or poor hygiene practices. In most cases, patients are reporting symptoms such as diarrhea, respiratory issues before it's coming and becoming clear that they have GBS. And investigations are ongoing to confirm why exactly the outbreak happened in the first place.
All right, so lots of questions there, and also understanding, is it only a Pune phenomena? Is it only happening in Maharashtra? Are there other places as well? Dr. Kunal Bahrani is joining us now. Hi, Doctor. Good morning. Thank you so much for speaking with us on this very critical issue. He's a clinical director and HOD Neurology at the Marengo Asia Hospital here in Delhi, NCR. So, Dr. Kunal, first up, GBS has been around for a while. We've heard very far and few cases, but suddenly for an outbreak to happen, what are the reasons leading to it?
Yeah, good morning. So first of all, GBS, as you said, it's a guillain-barré syndrome. So it's one of the threatening neurological disease which we see quite often. And why it happened? Why now there is a term called outbreak of GBS in the Pune. So usually, if we see the cause of this deadly disease, we see this disease only usually after infections. And usually we see two types of infections, whether it is a gastrointestinal infection or the respiratory infection. So this is not the first time we see the outbreak. Previously also there had been outbreak of GBS in many countries, like when there was a pandemic of COVID, there was an outbreak in Italy, North Italy. Simultaneously, there was an association with a Zika virus that was in the French. So usually there are definitely some viruses like Zika virus, flu virus, seasonal flu viruses, COVID viruses, and the most important, the bacteria, which nowadays in Pune, which we are seeing, is the Campylobacter jejuni, C. jejuni. So this is a bacteria which often leads to gastrointestinal infection. The early symptoms which led to are usually pain abdomen, diarrhea, fever, which usually last for a day or two. After this infective period, usually in next 2 or 3 weeks, usually these symptoms happens leading to GBS. So usually it starts with tingling sensation, pain, weakness, and usually there are many symptoms which patient usually ignore. So that is more very critical not to ignore these symptoms, because usually these are the initial crucial symptoms which need to be understood and which can lead to more deadly disease, this GBS syndrome.
Okay.
Doctor, tell us, we know it's an outbreak, but is it contagious? And by that I mean, can one human give it to another human?
No, it's not a contagious disease, because usually it spreads due to fecal-oral route, due to poor hygiene. We were consuming the poor drinking water, the poor sanitation, and all this leads to outbreak. So it's not a contagious, it's not an environmental borne disease. It's more of a fecal-oral route because of consumption of poor controlled water, where we are consuming uncooked food, meats. So these are the things which can usually lead to this disease, GBS syndrome, because of this poor hygiene. It's not a contagious, it's not such a disease which will spread from one human to another human, or which is spreading from animal to humans. This is not such disease. It's mainly because of poor hygienic conditions leading to this GB syndrome.
Okay.
Yeah, in fact, there have been studies that said that they found E. coli in one of the wells in Pune near Khadakwasla, which actually caused all of this. That is being under investigation as well. But Dr. Kunal, I have a question. These symptoms are fairly normal. The weather is just about changing. A lot of people are expected to sort of catch a flu. I seem to be getting something myself. So in conditions like these, how do you know that what you have is GBS, or should you rush to the doctor, and when can one just take some home remedies and rectify it? And second, I want to understand, a lot of these cases that have been reported are of kids who are below 7 years of age, and are those who are over 50 years of age. Are those the critical age brackets as well?
So let me answer you the first question. Usually we need to understand that our country, India, is one of the hotspot usually in the infectious diseases. So there are definitely hotspots are there. Like if we see Latin America, part of Africa, our India, Bangladesh. Why I'm saying hotspots? Because in these countries there are a lot of biodiversity, poor hygienic conditions, biodiversity, a lot of climatic changes. So these countries are more prone or these outbreaks of these infectious diseases. Many infectious diseases because of all these factors: biodiversity, poor hygiene, lack of sanitation, and in such outbreaks like this happened, GB syndrome. So as you said, initial part, this can happen in the manifestation of the outbreak, and this can also happen as a seasonal variation also, because many times we see sporadic GBS cases in simple seasonal flu. So in seasonal flu also we can see the GB syndrome, and usually numbers gets increased during the months of from July to September, when the flu numbers gets increased, when there is a weather climate change is there, where there is a more of rainy season is there. Because of these conditions also, this can trigger GB syndrome. So it's not an outbreak, it's a sporadic cases. Outbreaks happens when there is a good number of cases, when there is a good number of community spread is there, when we say it is outbreak. Now the distribution of age group. So usually GB syndrome happens in the bimodal age group. Usually first age group is there in the mean of adolescent from 10 years to 25 years. Second age group is usually from more than 50 years of age group. But as you said, in children from 5 to 15 years of, which is more dangerous in this age group, also in the elderly age group. Why it is so? Because already our immune system is not very well developed in these two peaks, and that is the reason it quietly we see it's more of dreadful disease. GB syndrome infestations are more during these two age group brackets, in the young age group and the elderly age group.
Okay. Doctor, list out for our audiences very quickly what they should stay away from, because right now there are a lot of WhatsApp rumors circulating. Some saying stay away from paneer, some saying stay away from all food from the outside. Just list out, please, very quickly for us.
So first of all, I will just say don't be panicked. We have to just follow some guidelines. Just follow some do's and don'ts. Usually, we have to keep a safe practice. Take a proper hygienic food, pure drinking water. Take up proper sanitation. We should avoid eating the uncooked or unhealthy meats. Many times we see eating foods from the places where there has not been properly hygienic foods. So that things we have to take care. And the most important, we have to take care of our hand sanitation. That is very, very important. That we followed even in the COVID era. The only thing which we used to say, take a proper hand wash. We need proper hand washing with soap and water. We need to disinfectant. So that is more important in this case. You have to avoid spread by just taking small these few things, because what we can do is just to prevent the infection from this Campylobacter jejuni. So in this case, if we avoid infecting from this organism, definitely we can prevent much dreadful disease like GB syndrome.
Okay, Dr. Kunal, very quickly, sorry, before we let you go, you operate in Delhi NCR. Could you give us some quick anecdotal, reference on, are you picking up any cases or any symptoms here?
So usually nowadays, as I said, usually we see sporadic cases. Mainly, we are not seeing the good number of cases anytime. But definitely, if I see the numbers, numbers are not very far, very high. Even in the cases of Campylobacter jejuni, if I say the number, so hardly in one, if we see the 1,000 Campylobacter jejuni infected patient, only one will develop GB syndrome. Not all will develop.
Okay.
So it's not a good number. Definitely, if I see the incidence also, hardly we see in one to two cases per 1 lakh population. So we don't see so much of numbers GB syndrome. That's the reason there is no need to panic. Only thing is, we should identify these closely symptoms. If anything happens to any patient, like some tingling sensation, weakness, immediately follow to a neurologist. That's what I'm saying, because in the initial only, if you pick these GBS syndromes symptoms, definitely we can prevent the late complications of GBS syndrome, and that can prevent such manifestation.
Got it. Got it.
Doctor, thank you. And thank you for telling our audiences so comprehensively what we can do to better take care of ourselves.
All right.